Hello everybody, my name is Hassan Nafid. I am an anatomy and physiology instructor at Madison College in Wisconsin. We will continue talking about our anatomy and physiology sessions. This time we are going to talk about one of the bones of the axial skeleton. Remember last time we divided our skeletal system into two main categories, the axial skeleton and the appendicular skeleton. So this time we're going to talk about the skull. The skull is the home of the brain. The skull is also known as the cranium. Skull is formed of two parts, cranial bones and facial bones. And within the skull or within the cranium, there is some space, and this space is known as fossas. These fossas are divided into three pieces or three parts. The skull is formed of bones, and these bones are joined together by interlocking joints, and these joints are known as sutures. These joints are immovable to protect the brain. The only situation these joints were movable was in the intrauterine life, and this is simply to help the passage of the fetal head through the birth canal upon delivery or as the child births. So they kind of modulate over each other, but right after birth they permanently close. If I showed you a fetal skull here, you will notice that there is a defect here in the front. This is known as the anterior fontanelle, and this is a defect that is naturally found in a newborn, and it closes by the age of 18 months or 24 months. There is one in the back that is the posterior fontanelle, and it closes right at birth. And these are the sutures. In the adult skull, the sutures or these immovable joints are here, and they are seen as these lines. This is known as the sagittal suture. This is the front of the skull. If I put it back in here on the skull to show you. Here, you can take a look at it. This is our skull. This is the front of the skull. So I'm going to put it back here to show you these sutures. We have the coronal suture, which runs across on the front from right to left or from left to right, doesn't matter. And then we have the sagittal suture, which runs from front to back in the midline. And in the back we have the lambdoid suture, and the lambdoid suture kind of takes the lambda shape. As I said, the skull has facial bones, which is in the front, and cranial bones, which are all over the other parts of the skull. I'm going to use the colored skull here to help understand and point clearly these bones of the skull we're talking about. So if you take a look at this skull here, I'm going to start with the cranial bones. On the cranial bones, if you observe, the blue bone here is known as a temporal bone. This is the temporal bone, and it's separated from the parietal bone, which is the red one, by the squamous suture. That's another suture. It does have a projection here. We call it styloid process. This is a styloid process. It's a little tiny one here. And we have a bigger one here. We call it mastoid process. And here, if you see, this is the opening of the ear. We call it external meatus, or external opening. And that's where you find the ear. Go back again here. If you look at the top of the skull here, this is the parietal bone. The parietal bone is a larger bone, is found and extends in the two sides of the skull. In the back, the yellow bone, the yellow colored bone here, is our occipital bone. And in the front of the skull, we have a bigger flat bone here. By the way, the bones of the skull are flat, of the cranium specifically are flat bones. This is the frontal bone. The blue one is the frontal bone. If we move to study the bones of the facial part of the skull, there are multiple bones and they have shapes that are kind of irregular, or they're not flat enough to be called flat bones. This is the zygomatic bone. The yellow one is the zygomatic bone. It's also known as the cheek bone. It does have an arch, as you see, and it does have a little angles to it. The orange or the brown bone here is our maxillary bone. The red bone here is our mandible, or the jaw bone. And the mandible is the bone that have a U-shaped or a C-shaped bone. Does have an angle, have a ramus, have some processes. It is two foramina here. Mental foramina. I'm going to put the prop in here to show you. Let me put it a little better. Hold it a little better here. So this is our mental foramina. There is mandibular foramina, and this is from inside, is in the medial side of the mandible here. If you see, I'm going to turn it to show you the interior part of the mandible, what you call the medial part. If this is the lateral part, then it's going to be the medial part of the mandible. And that's where you find your mandibular foramina. Another one is here, where the prop is. Let's try to make it a little clear for you. Also, we have the nasal bone, which is this bone here. And of course, here you could imagine the cartilage of the outer part of the nose. On the side here, we have the lacrimal bone. This is known as the lacrimal bone. This white one. This is our ethmoid bone. That's shown you here is our ethmoid bone. Let me throw some light here so we can look at it better. Our ethmoid bone. Okay. In the back, the brown color, this is our sphenoid bone. And the sphenoid bone is a bone that can be seen from the exterior part of the skull as well as from the interior part of the skull. When I open the cranial cavity and show you these bones again. If you Notice here the orbit or the bony part of the skull has multiple bones, almost like 5 bones that contribute to the formation of the orbit. You have in the top your frontal bone, we have the sphenoid bone, we have the zygomatic bone, we have the maxilla, or the maxillary bone, we have the lacrimal bone, and we have the ethmoid bone. I'm going to open the inner part of the skull to share you the other structures. Again, this is our anterior or frontal bone. Hold it better here. This is our frontal bone. Okay. Here, this is the ethmoid bone. And this is the cribriform plate of the ethmoid bone. And that part of the bone that is a little sharper sticking out, this is the crista galli. Crista galli. This bat-shaped bone, which is brown in color, this is our sphenoid bone. It does have 2 parts. The lesser wing, which is this, and the greater wing. As you see, it looks like a wing. One is smaller, which is a lesser wing of the sphenoid bone, and this is the larger wing of the sphenoid bone. In the middle here, you're gonna see our sella torsica, and the sella torsica is where you find the pituitary gland. That's the spot where you can find and identify our pituitary gland. Again, this is our temporal bone, and this is our occipital bone. There is 3 fossas here, if you notice, one in the front, one in the back, one in the middle. So this is the anterior cranial fossa, this is the middle cranial fossa, and this is the posterior cranial fossa. This big opening here, this is the foramen magnum, and through which the spinal cord passes. There is some other foramenas that we could identify and see in the skull. And these are holes or foramenas through which some structures leave and enter the skull. I'm going to show you some of them, not all of them. Like these are the jugular foramina. You see them here, right? Next to the skull, this is the jugular foraminas. One in front of it is the internal acoustic meatus right here. And in the front, you're going to see foramen ovale. And here's the optic nerve foramina, through which the optic nerve comes. Also, it is useful to look at the skull from the front. Like you look at the orbit, and then when you look at the orbit, you might identify some fissures or some openings, like the superior orbital fissure. I'm going to put the prop here so you can see it. Superior orbital fissure, or inferior orbital fissures, and so forth. This is the colored skull we studied. If we take a quick look at the regular plain skull, you're going to see the same structures. Is your sella torsica, your foramen magnum, your foraminus jugular, and your internal acoustic or foramen ovale, and the others, which we have to look at them in the lab. This is all we have today about the skull. Until I see you next time, I wish you the best. Thank you.